Cost shifting is the 800-pound gorilla in our healthcare system, and this is why some of the reforms have not worked out so well. To grasp the damage done by this cost shifting, let's look at a hospital for an 8-day period as representing our entire healthcare system. It could be a clinic or a doctor's office, but let's just call it a hospital for the sake of having an easily understood example that we're all familiar with. Let's look at a Sunday through a Sunday and say it costs the hospital $1 to operate for a day. That $1 might represent $10,000. It might represent $500,000, depending on the size of the facility, but let's keep it at $1 to make the math easy. So the hospital needs $1 a day to operate. Well, let's say that our Medicaid patients use the hospital on Sunday, Monday. That's roughly their share of actual health care usage. So Medicaid uses the hospital on Sunday, Monday. But Medicaid only pays 65 cents. The hospital needs $1, but Medicaid only allows 65 cents. Someone's going to have to make up the difference, and you can probably make a pretty good guess already about who that somebody is, right? Then, on Tuesday, Wednesday, our Medicare patients use the hospital. It costs the hospital $1 a day, but Medicare only allows 72 cents. You know who is going to have to make up this difference, too. Then on Thursday, the hospital is used by workers who work for big business. They pay $1 because the big businesses have negotiated better deals than the rest of us can get with the health insurance carriers. Friday and Saturday are the workers who work in small business and self-employed. They pay $1.39. It only costs the hospital $1, but workers who work in small business and self-employed have to pay $1.39 to make up the difference for what Medicaid and Medicare didn't pay on Sunday through Wednesday. Then on Sunday is the out-of-pocket section that represents the portion of care where workers pay out of pocket. We pay the highest rate at that point, $1.48. That's how the hospital collects the $8 they need for the 8-day period. But the workers are getting clobbered by this cost shifting. And the cost shifting is what needs to be eliminated in order for any of these health care reform solutions to work. Because it doesn't matter what state the worker buys their policy in if the hospital is charging workers $1.40. Doesn't matter whether you call the program a subsidy or a tax credit. If they're still getting the cost shifted onto them, then that's the problem. The young and healthy aren't going to want to pay $1.40. Get the cost down to $1, then the young and healthy might be willing to participate. But as long as this huge cost shifting is occurring, it blocks most of these healthcare reforms from working the way we want to. And let's dispense with the nonsense that by paying less than $1, Medicare and Medicaid are saving taxpayers money. BS! They're just making us pay it from a different pocket. Instead of paying $1 from our tax pocket and $1 from our health insurance premium pocket, we're paying 70 cents from our tax pocket and $1.30 from our health insurance premium pocket. It's still a total of $2. Medicare and Medicaid aren't saving us anything. They're just shifting the cost into a different pocket. In fact, there's a strong argument that by distorting the market, Medicare and Medicaid are actually costing us more because the cost shifting keeps the young and healthy from participating. So here's how the retirement plan solution for Social Security and Medicare can help solve the cost-shifting problem. It brings Medicare up to paying a full $1 instead of just 72 cents. So there's no shifting from Medicare onto workers. Plus, each worker's retirement account pays for our own Medicare premiums, so other workers don't have to pay for us. That will alleviate almost half of the cost-shifting burden on workers. The remaining burden will be the Medicaid portion, which will still need to be dealt with, but it will be a smaller issue to tackle, and we'll have a growing economy and prosperous families to work with. So it will be fairly easy to solve that remaining part. By increasing our contributions devoted to the retirement plan to $1,700, remember that from Part 1, we can more than double our Social Security benefits and bring Medicare up to paying the full $1 instead of just 72 cents. So that's how flipping the switch back to the retirement plan track for Social Security and Medicare can help us get to where we want to be in healthcare. In effect, we create a new source of revenue to pay for a large part of our healthcare costs. We start using compound interest to pay for most of our Medicare benefits. That's a source we aren't using today. It reduces the portion of healthcare costs we pay from our paychecks, which in turn boosts economic growth, which in turn makes it easier to handle the Medicaid piece. All we need to do is flip the switch and set this chain of events in motion. Thank you.